Hi everybody, welcome to Health Wanted, the place to be for healthy living. Join us today as we explore post-traumatic stress disorder, PTSD. We'll cover its symptoms, causes, diagnosis, treatment, and more. Don't miss out, as we'll be sharing valuable information for individuals living with PTSD or supporting a family member affected by it. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is post-traumatic stress disorder? Some persons who have experienced a startling, terrifying, or deadly event may develop post-traumatic stress disorder, PTSD. Fear is a normal emotion both during and after a terrible event. The fight-or-flight reaction in our bodies, which helps us avoid or deal with possible danger, includes the emotion of fear. After a traumatic event, people may react in a variety of ways, and most get over their initial symptoms eventually. A PTSD diagnosis may be made for those who still have issues. Who experiences PTSD? PTSD can strike anyone at any age. This covers those who have served in the armed forces as well as those who have been the victim of abuse, assault, or other serious incidents, including accidents and disasters. Even when they are safe, people with PTSD may experience anxiety or tension. Not every person suffering from PTSD has experienced a traumatic event. PTSD can occasionally be brought on by finding out that a friend or family member suffered trauma. A program of the U.S. Department of Veterans Affairs, the National Center for PTSD, estimates that around 6 out of every 100 persons will at some point in their lives have PTSD. Compared to men, women are more likely to get PTSD. Certain individuals may be more susceptible to developing PTSD due to certain elements of the traumatic incident and biological variables, such as genes. What symptoms and signs are present in PTSD patients? Though they occasionally appear later, PTSD symptoms often start to show about 3 months after the stressful event. In order to be diagnosed with post-traumatic stress disorder, PTSD, an individual must have symptoms for more than 1 month and have enough severity for them to interfere with daily functioning, including relationships and job. Additionally, there must be no connection between the symptoms and drug usage, alcohol consumption, or any other medical condition. The condition progresses differently. While some people get well in 6 months, others experience symptoms that linger for a year or longer. Co-occurring illnesses like depression, drug abuse, or one or more anxiety disorders are common in people with PTSD. It is normal to have certain symptoms following a risky occurrence. For instance, some individuals might have a sense of detachment from the event, as if they are seeing rather than feeling things. If symptoms match the criteria for PTSD, they can be diagnosed by a mental health professional with experience treating individuals with PTSD, such as a psychiatrist, psychologist, or clinical social worker. An adult needs to experience each of the following for at least 1 month in order to be diagnosed with PTSD: at least one symptom that has resurfaced, at least one symptom of avoidance, 2 or more signs of arousal and reactivity, and at least 2 issues with mood and cognition. Symptoms that recur include reliving the terrible experience through flashbacks, along with bodily signs like perspiration or a pounding heart, having recurrent nightmares or flashbacks of the incident, having unsettling ideas, and displaying outward symptoms of stress. These symptoms can be brought on by words, items, settings that serve as reminders of the incident, as well as thoughts and feelings. Avoidance symptoms include avoiding situations, people, or things that bring up memories of the traumatic occurrence, and ignoring sentiments or ideas associated with the unpleasant experience. People who experience avoidance symptoms may decide to alter their routines. For instance, following a severe auto accident, some people might refrain from using a vehicle or from riding in one. Symptoms of arousal and reactivity include easily frightened, sensation of tension, alertness, or edge, having trouble focusing, having trouble getting to sleep or remaining asleep, being agitated and prone to violent or furious outbursts, and taking up dangerous, careless, or destructive activities. Symptoms of arousal are frequently ongoing. They may cause tension and rage, as well as make it difficult to focus, eat, sleep, or go about everyday activities. Symptoms of mood and cognition include having problems recalling important details of the traumatic experience, thinking negatively about oneself or the outside environment, feeling excessively guilty about oneself or other people, feeling bad all the time, like fear, rage, remorse, or shame, losing interest in fun things to do, experiencing a sense of social exclusion, and experiencing difficulty experiencing happy or satisfied feelings. After the stressful experience, problems related to mood and cognition may start or get worse. They may cause someone to feel cut off from friends or relatives. Which characteristics put someone at risk for PTSD? There are several elements that contribute to the development of PTSD in survivors of risky events. While some of these elements exist prior to the trauma, others gain significance during and following a traumatic incident. The following risk factors could make PTSD more likely to develop: being made aware of past painful events, especially those that occurred in childhood, experiencing harm or witnessing others suffer or die, experiencing terror, powerlessness, or intense fear, lacking in social support following the incident, coping with further stress following the incident, such as losing a loved one, experiencing pain and injury, or losing one's career or house, and possessing a personal or familial background of substance abuse or mental illness. The following resilience factors may lessen the chance of having PTSD: asking friends, family, or support groups for assistance, acquiring the ability to accept oneself and one's behavior after a terrible incident, use a coping mechanism to get through the terrible experience, and despite experiencing anxiety, being ready and able to react to difficult situations as they arise. How is the treatment for post-traumatic stress disorder? Working with a mental health professional who has experience treating PTSD is crucial for anyone experiencing symptoms of PTSD. The primary therapies consist of either medication, psychotherapy, or a combination of both. People can identify the ideal treatment plan for their symptoms and needs with the assistance of a mental health specialist. Some PTSD sufferers, like those in abusive relationships, might be dealing with recurring trauma. In these situations, treating the traumatic event as well as the PTSD symptoms usually yields the best results. Individuals with PTSD or traumatic experiences may also struggle with panic attacks, despair, substance abuse, or suicide thoughts. Following trauma, treatment for certain illnesses can aid in recuperation. Studies indicate that social and familial support might play a significant role in the healing process. Psychotherapy. Mental health practitioners utilize a range of treatment strategies in psychotherapy, often known as talk therapy, to assist individuals in recognizing and modifying distressing feelings, ideas, and behaviors. Psychotherapy can help PTSD sufferers and their families by offering them support, information, and direction. Therapy can be given one-on-one or in a group setting, and it typically lasts 6 to 12 weeks, though it can go longer. While some forms of psychotherapy concentrate on social, familial, or work-related issues, others address the symptoms of PTSD. A few essential elements are frequently emphasized in effective psychotherapies, such as teaching patients how to recognize triggers and control symptoms. Cognitive restructuring and exposure therapy are two popular forms of psychotherapy known as cognitive behavioral therapy. By progressively exposing patients to their traumatic experiences in a safe manner, exposure therapy teaches them how to control their fear. People may reflect on the trauma, write about it, or go to the scene as part of exposure treatment. People with PTSD may experience less distressing symptoms as a result of this therapy. Rearranging one's cognitive structure aids in understanding the traumatic experience. People's memories of events often differ from their actual experiences. Regarding something that is not their fault, they could experience shame or guilt. People with PTSD may find it easier to process what happened realistically with the use of cognitive restructuring. Medications. 2 selective serotonin reuptake inhibitors, SSRIs, a class of antidepressant drug, have been licensed by the FDA in the United States for the treatment of post-traumatic stress disorder, PTSD. SSRIs may assist in the management of depressive, anxious, angry, and emotionally numb symptoms associated with PTSD. In addition to psychotherapy, medical professionals may prescribe SSRIs and other drugs. Specific PTSD symptoms, such nightmares and difficulty sleeping, may be treated with some drugs. In order to determine the appropriate drug, or combination of medications, and dosage, people should consult with their healthcare practitioners. Speak with a healthcare professional to learn the most recent information regarding drugs. How can I get PTSD treatment? A medical professional can recommend a certified mental health practitioner, such as a psychologist or psychiatrist who has treated PTSD, if you're unsure of where to turn for assistance. Learn how to plan ahead and make the most of your visit, as well as where to find assistance. To locate mental health resources in your area, visit the online treatment locator provided by the Substance Abuse and Mental Health Resources Administration. While undergoing treatment, you can take the following actions to better yourself. Follow your treatment plan and discuss treatment alternatives with your healthcare practitioner. Take up mindfulness exercises, physical activity, or other stress-relieving hobbies. Strive to stick to regular eating, sleeping, and exercise schedules. Set manageable objectives and concentrate on your capabilities. Tell trusted friends or family members about situations that could aggravate your symptoms while you're together. It is not expected that your symptoms will go away right away, and steer clear of alcohol and drugs. PTSD recovery can be a difficult road, but many people can recover and take back their life with the right care, counseling, and coping mechanisms. In order to promote understanding and offer practical help for individuals impacted by PTSD, it is imperative that research, awareness, and destigmatization continue. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.